Hello, everybody.
Hi.
I do it in English, it's fine? Yeah? Okay. If there's some questions with vocabulary and everything, I can translate.
You speak Luxembourgish?
German, French, Portuguese, English.
Spanish?
No. Okay, so I'm Jan, and I'm here to talk about hips and in regards to what can I do as a dancer for prevention, so don't get injured, and also what I can do in preparation before dancing. And yeah, I will talk a bit about the anatomy, and I will show you what you can do as well. So we have a more theoretical part and also some exercises that we could try together, which would be the best if we try it here. And yeah, so hips don't lie. Yeah. So I'm a physical therapist, kine in Luxembourgish, and I also am a student with no edge for dancing sometimes. Yeah. And my sister is here as well. She's a dancer, so I had the opportunity to work with some of her friends as well, and I'm very interested in working with dancers. It's cool because they are very interested in how they can improve their movements, and yeah, it's cool to work with them. And so I just want to quickly know what you are dancing and maybe your name. So maybe we start there. Yeah.
So my name is Eunice, and I dance Afro, also hip hop a little bit.
Okay.
I'm Laura, versatile hip hop house years. Comes along.
I'm Ben, I'm doing breaking and popping.
Okay.
Alicia, I'm doing hip hop, popping, and whatever happens.
Kannst du Lützeburg
Yeah.
Also, ich stehe da und ich mache Jazz und Hip-Hop.
Mm-hmm.
Ich heiße Kaya und ich mache auch Hip Hop und Jazz.
Ich heiße Jojo und ich mache eine Mischung von allem.
Ich bin Ina, sag ich mal hip hop.
Okay. Cool. So, what I planned is why the hip are we here? So, a bit why it's interesting to talk to dancers about hips. And then a bit of anatomy, so understanding where are my hips and of what are they made. And and then we get into like what maybe are exercises that I could do myself for mobility and motor control, which I will explain what it is. So we talk about the pelvis, yeah. And so I call this "Be like Elvis, control your pelvis." And so then the hip, so this is 4-position hip circles, it's just the name of the exercise. And then maybe we talk also about pelvic floor and why you want to train it. And then if we have some time, we can answer some questions, or somebody has maybe an issue that he has a question about, or whatever comes up, okay?
Yeah.
So why are we here? So in general, so the hips are the link between the trunk, so the upper body, and the legs. And a lot of the movements in dancing come from the hips. Like you have to find your energy from, or you initiate the movement from the hips. So that's why it's interesting to have a good control there, to be strong, to not get injured, and move good. Everything fine with English for everybody? Okay, good. So, oh yeah, if somebody has a question, you can just show it, like raise your hand, and then we answer it on the spot because maybe it's too difficult at the end or we don't have time. Yeah. So, and 2 principles why we want to do maybe some warm-up, some stretching or whatever for the hips would be that if I don't feel a body part well, I can't move it well, I can't control it well. That's also why injuries happen often. And then if I'm not flexible in a joint, my muscles are generally weaker, so I have less strength. Okay? And these are like principles that apply for our bodies in general. So it's not just for dancing, it's for every movement we do in life. Okay, it's not important that you can't read maybe the first part, so I will just say, it's like, if you go on the internet and you say, I have a hip problem, generally what you see is they talk about strengthening the hip, like strengthening the glutes, because that's very common now, and you find thousands of videos about this, and it's maybe valid for some people, but is often not the solution. Yeah. So a lot of these videos, they promise stuff that is actually not so true. But for some people it is true. And for example, they did some studies, so you cannot read it, but it's about if you have a hip that is not moving so well, you have often knee pain on the front. So people that have like a pain here on the front of the knee, very often it comes from bad control in the hip, for example. Yeah. Then something I didn't put on there as well is a lot of the pain here on the front of the hip would be generally because of the adductors, so the muscle on the inside of the leg, which are not the glutes, it's the opposite muscles. So knowing already this is maybe interesting. Yeah. So if I have a pain here on the front, strengthening your glutes and you're doing a lot of extension work for the hip is not actually doing anything, maybe even making it worse. So knowing a bit of these differences. And then there's another study that they did in football, because in football, American football, but in general it's people that are injured a lot, and so they want them to not be injured, and so they do a lot of studies about this stuff. And so they found out that if you have less rotation to the inside, so this moving in, that gives you a way higher risk for a very bad knee injury, which is called ACL. Yeah, it's probably the worst injury that you can have on the knee, like the Kreuzband. Yeah, maybe someone has heard about it. And so having a good functioning hip that is flexible but also controlled is very important. And these are some study results that show this. Yeah. So just to give you a number, if you have 30 degrees less, so instead of this, you have maybe just this, your risk is 5 times higher for this knee injury. So it's a lot, okay? Okay? Any question? No?
So what you say is if you are not flexible on that
to the inside, yes. This is what this study showed.
Yeah.
Of course, not being flexible on the other side, like this outside rotation, the other way has also other problems. Yeah. Okay.
Yes.
But I can go over this one more time. Then I want to say something that is, yeah.
It's just for the knees.
No, it's
Injury,
it creates more problems for the knees. Yeah. But like I said in the beginning, for example, if you have hip pain, it's often associated to weakness in the adductors or problems in controlling. So adductors, I will just explain it after, but it's the muscles that bring the leg to the inside. Yeah. So, and then something I wanted to show is often when you have pain and it's not going away, what you are told is, okay, go to the doctor, and the doctors check your hip and they will do some images, okay? And then they will maybe see something, okay? Maybe not when you are younger, but already in the beginning of the 20s, if you go to the doctor and you do an image, a lot of times you will find something on the image, which doesn't mean that this is causing your problem. Okay? But if I go there and I have a pain and we see something on the image, then we are very tempted to say this is our problem. So I'm just going to give you some numbers. So people under 40 that have no symptoms, so no pain, 85% have a labral tear. So this is like on the inside. I will show it maybe here. Yeah, you see this is the bone, and this is where it sits, and there you have like a, yeah, you could say like a lip that is keeping the bone in place and helping that the bone can move well. So 85% under 40 have a tear without having any pain. Yeah. This being said, then we have maybe, for example, even 11% have a fracture. So they have a fracture and they have no pain. Okay. But it's always good to check if it's not something worse. So you should always, if you have a pain, you should consult a doctor and exclude there is nothing worse. Yeah? This being said, maybe there are some other solutions than just saying, okay, my hip is broken. Okay, that's why I'm saying it. Okay. Questions? No, good. Big eyes. Okay, so just quickly to understand which are the bones that we are talking about. I kept it simple, but there's two huge bones. So we have the pelvis, which is usually talking about this whole thing there. And then we have the femur, which is the upper leg bone. Yeah, and where they connect, this is the hip joint. This is where it is. And acetabulum is maybe something that you see, is just this part, so where it attaches, this is called acetabulum. Okay? Yeah. So, I just want to go over some words, what is what, yeah? So we have flexion, and then I put some names of some muscles, maybe someone knows these muscles or has heard about them, and extension, yeah? Flexion would be bring my leg up, okay? Extension would be everything to the back, okay? And I found this term. Okay. Okay. So hamstrings, hip extensors are here on the back side of the leg, of the thigh, and the glutes are here. Okay. So these are the two muscles that bring the leg back. Okay. So if you do, for example, you're lying on your back and you do a bridge, you put the pelvis up. This is the muscles that you use. Okay. Or if I walk and I push myself forward, or I jump, I use these muscles a lot as well, okay? Then psoas is a muscle that is here on the inside and is also often responsible, like I said, if I have a pain here on the front, it can come from this muscle, yeah? Then, so internal, external rotation, this is always confusing. Okay, so she is doing an internal rotation, yeah, and they are doing external rotation with both legs at the same time. I cannot do that. Not like this. Okay, stand up and try it. Otherwise, it will be confusing. Oh my God!
Not to jump this?
You have to go. Yeah, no, not the jumping. So we are just gonna go. so just do the external rotation. So why is this confusing? Because my leg is coming inside, right?
Yeah.
So it's confusing. But we are talking about this bone, and this bone is turning out. Okay? Even if my leg is on the side, out. Okay? This is external rotation. So if you don't want to get confused, just take your leg and turn it out, then you are doing external rotation. Yeah? We can also do it one time like this because we will use this after. This is out, so external rotation, and this is in. Let's try it one time here for in. And maybe you can also already compare for yourself which one is going better for me. Like, am I better at this or am I better at this?
Most people are better out, no?
Most people are better out. Yes. This has to do with the joint. Yeah. So it's completely normal that you would be better at this than at this. Okay? Okay? Just stay there. So we have abductors with the B is leg out. Yeah, just leg to the side. Or if I go here, is also leg out, right? For this side, this is my leg is going out, abduction, okay? And then the contrary, adductions to the inside, over the middle of the body, inside, okay? Mm-hmm. Yes? Okay, good. Add adduction. Yeah.
Thank you.
So of course these are very good, yeah. So maybe you don't need so much this class if you are like them. Okay. So I think we can talk about mobility already, since we are already standing. Even though for this we probably need to lie down, yeah. No, we can actually do it standing for some versions. So, mobility is what a lot of people spend a lot of time with already. So I'm not going to focus too much on it. It's what most people would talk about as stretching. Yeah? I go in a position and I stay there. Maybe I move a bit. Yeah, and I stay there is mobility. Yeah, I'm not moving. I'm just trying to get further in the movement. Yeah, a lot of people talk about stretching, and it's something that is more known. Yeah, so I'm not going to go into detail about all the stretches you can do. If you ask me after or you want to know, I can show a few things, but I'm not going to focus on that too much. Okay. So what I wanted to show you is something that is called distraction. So how can I create space in a joint? Yeah, so opening my joint up, open it, create space. Yeah, okay. So I have a version with the band that I will show you, but we can do it as partners. So somebody just has to pull a bit on the leg. Yeah, it's not too difficult. So maybe go as pairs. Yeah, and I will show it here on the front how we can do it with the hands. Okay, maybe take some pillows. Do you mind lying on the floor? No, or like on the maybe the back on the pillow. Yeah. So I need a voluntary. Tu veux? Oui. So I will just show it. On fait ici, là, là. Cameraman. Here. Okay. Tu te mets sur le dos.
Comme ça?
Mm-hmm. So, my dancer is lying down, and all we want to do is we want to create space in this joint. So you remember there was a bone and it was attached to my pelvis. Yeah? So we want to just get some stretch there. So we don't have to pull very hard so that he's sliding through the room. We just grab the leg and we just pull a bit, okay? I will show how you can do it by yourself with the band, which is probably more useful, more practical, because we don't always have someone pulling us, yeah? Okay, so I just grab the leg. I don't grab on the foot, just over the foot, and I just pull a bit, okay? And, huh?
A bit in diagonal.
Yeah, so I can go here, yeah, but I'm going a bit out. So maybe we can turn this way one time. So I take the leg and I go a bit out, yeah? And what he can feel is that probably his hip is a bit looser here. And if I go here, it's not moving as good as here, yeah? This is the most loose position, okay? So we can do it just holding. We can also just move a bit side to side, up and down, yeah? These are some possibilities. Okay, maybe I show immediately with the band. Okay, so we turn this way again. So I will show it like this, and the more comfortable version. So this is just an elastic band, a strong one. Yeah, these are very good because they are out of tissue, but you can use the normal ones, the power bands. They are like 20 euros or something, okay? And we just go here under the foot and then we cross. Sometimes I also do like double, okay? And what I can do is, if I do it alone, I attach this somewhere and then I slide away, yeah? So if I'm just here and he wants to create tension, he can move a bit there and he can himself do this. C'est agréable, hein? Yes. And he can even like move it a bit, so he can move his leg a bit and really relax, yeah? If he says, okay, I want to go a bit further, for example, we could go to the outside because he maybe feels that he needs some more mobility on the inside, yeah? When he goes here, he feels it a lot. He can move a bit to there and just create this passive. Passive is for me like you are not doing much, yeah, and create this for himself at home, yeah. You just need a good anchor point. So if you use a door, we don't have a, don't put it from the front, open the door and you put it the other way. It's just a tip. Then nothing will happen, okay? Okay?
This leg, you always bend it?
So this is a bit how it's more comfortable for you. You can just put it down. Okay. If you want to have your back, if it's more comfortable up for you, you can also put it up. Okay. Yeah? We can try again. And you put it down and you decide for yourself what is better. Or maybe both is fine. Yeah. Mm-hmm. So one group can try with the band, because I have one band, and the rest in the joint. Yeah, so what I want you to do, this is good that you ask. So maybe I want you to just test something. Yeah, one of the movements that we tried before. So maybe this, maybe this, maybe this, or maybe flexion. You can test whatever you want. Yeah, and choose one where you feel like, this feels not so good for me, or I could go higher on this side, and then we try the exercise. Okay? Yeah. Let's just take 2-3 minutes to do this, yeah? And if someone needs help, you just call me. So, for testing, this, yeah? This, or maybe abduction, or maybe to the inside. Yeah.
What important is as well not to
Exactly. Yeah. Yeah. So this part. Okay. If everything is fine, yeah, just try the exercise.
Yeah.
Okay. You need your pillow. Let's proberen. Fine. So you can a way to do it maybe better is to go down, yeah. Then you feel maybe more comfortable and you can use your weight, yeah. If your if your partner is sliding through the room, you are pulling too hard. Okay. Du kannst vielleicht gucken, wenn du den Knie hin musst. So. Voilà. So. Aber wenn du gucken kannst, geh noch ein bisschen mehr high. Mehr high auf die Seite. Ja? So, pardon. Du kannst vielleicht den Fuß aufstellen. So. Da rutscht du nicht so viel. Ja. Let's do like 30 seconds. Yeah.
Ça change aussi si on met la jambe plus haut.
Oui. Oui. If somebody wants to try with the band. Okay. Stop. Test. Yeah. So test your movement from before. Of course, the person that has been lying down. Yeah.
Preferably.
If the other person got better or worse. Yeah. Okay, good. Yeah. So, one thing I have to say is what always will happen in a group is some people will be happy, some people will be like, yeah, okay, it's okay, and one person might be like, I don't move so well now. Okay, that is normal. Okay, because everything that we are doing here, like every exercise, is a bit personal. For some people it will work. For others, it won't. Yeah? Okay? Change? Yeah? Test. 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 Test the movement. Yeah, the person that is lying down has to test before. Because if you go home, you want to know, is this something I want to do? Or is it not so useful for me? Yeah?
For me, I felt like I had more of like mobility here, maybe
Yeah.
a little bit, but I had less balance.
Yeah, it's because maybe it feels a bit off.
Yeah.
But I would go with the mobility here. Okay? Ja? Willst du? No. Ja. Ja.
Also keine Ahnung, guck mal, das knickst so.
Ja. Also, das heisst nicht unbedingt etwas.
Okay. Also dit moet wenen, dat is niet zo.
Solange es nicht weh tut, ist es nicht schlimm. Okay, wenn du allkeers knackst, da kann vielleicht sein, dass du mehr stabil gehen musst. Dann ist der Toten zum Beispiel nicht unbedingt das Beste für dich vielleicht. Aber du kannst es einfach probieren. Ja, okay? Ja? Auf welcher Seite? Links. Willst du mal ein Banddenken probieren? Da kannst du, weil da eine Variante ist, die du kannst. Hä? Ja. Bis du spürst, das bisschen am Gelenk, das tust, gell? Das ist noch nicht mega, und da probierst du zu relaxieren. Okay? Wir können vielleicht den Fuß noch ein bisschen nach außen drehen. So. So it doesn't, the stretch, or what you might feel, is very soft, okay? It's not like a stretching. You will not have like a slight pain or anything. You will just feel maybe that your joint, or in the front of the hip, yeah, that there's some space created. And you can even imagine like the two bones going a bit apart. This helps to make it better. So you can put your hand here and just imagine that this bone is going down. Yeah, this helps to make the exercise more effective. Okay? A bit lower. So you have here on the side the bone and you go under. Yeah? ob Lützeburg so mal vielleicht Leest, also ja, oder an der Verlängerung von der Leest, ja, okay? Du kannst ein bisschen mehr auf die Seite kommen. Ja. Okay? Let's test. Aber wenn das Fuß dieser Gräbel ist, kann ich noch einen Duch hinmachen oder so. Ja. So, just test. Good? Bad?
This side better.
Okay. Who got an improvement? Who is sure that he's like, oh, this helped me in general? 1, 2, yeah, 2, 3, 4, 5, 6. Okay, maybe. So 6 yes, 1 maybe. Okay, which is good. Yeah, we are 2, 3, 6. So 9 people. So out of 9 people, 6. Okay, it's cool. So, okay, one more thing. So we did the most simple version. You find on the internet, you find all types of variations of this. Okay, I will just show if someone would be voluntary. Yeah, come here. And you do like a squat. Yeah, just a basic squat. Okay, so
How long?
5 minutes. Until when do you? Okay, so I can put this band on the front, from here, from the back, yeah, and create space in the joint. So if you say, for example, when I go down in the squat, I feel it a bit, maybe you can do this, a similar thing, a similar effect in a squat position, not like this. Even though this exercise, the first one, could help you, let's try something else, okay? So we go here, and she will adjust the band on hip height, okay, more or less. Yeah, and then if I would be a wall, I would ask her to go where she feels something, and then she can go, for example, do a few squats, yeah. And sometimes, if the band is too much from here, I have to step to the front, so I have to find a position that is comfortable for me. And or some people need stronger, so then you just create more stretch, yeah, if you do it with the band. It's possible to do this with a partner if you have just like a bigger rope or something or a band, and then the partner does it. Yeah. Yeah, okay?
I
Test.
confirm that this is very helpful for my hip.
Yeah, so,
Yeah.
yeah, okay, so
No, I couldn't
for her it
do
helps.
without this.
Yeah.
No. Not without pain.
And the good thing in general, what you can maybe also understand is, if let's say I do a squat like this and I feel it, it's bothering me, yeah, I have of course the possibility to say, okay, I won't squat as deep, yeah, but then you don't develop so much muscle when you do a squat, okay? If with this you can go deeper, all of a sudden you found a way for your body to actually do the exercise and go there where usually you can't, and so get stronger in a position where otherwise you couldn't go. And over time doing it more often, your body will be like, okay, this position is completely fine for me. Yeah, this is why this stuff. Yeah, so if you get stronger, because maybe when you go down, you create too much tension here, and by adding the pull of the band, your body is like, oh, okay, now the bones are moving better together, and then I can go there. And over time, you get strong there, so then your body is like, okay, it's fine. You relearn the movement, basically, okay? In a better way, where the bones can move better together. Yeah? Question? No?
How to know in which direction we have to go?
For example,
Have to try.
You could try, yeah. You could, of course, like I said, you understood the basic principle of the exercise. So now going on the internet and looking on YouTube, what kind of these exercises does exist, you could do that, like do your own research, yeah? If you tell me, for example, so maybe I can just show 2 other variants, yeah? So maybe we can go into somebody can go here. So if, let's say you feel like you're restricted when you go down, so you feel something here on the front, who wants to try?
It's like we change every time.
Yeah, changing is more fun.
I can say for myself, because you asked for the direction maybe, or how you know. Well, you know when it releases, like when the pain gets less, you know that it's helping.
Yeah.
Like when I do a squat and this is painful, although I have the band, maybe if I go this way and it pulls there, okay, it creates more space, so it's less painful, so I know, okay, this is the angle that is right.
You can basically try in the movement, yeah? Or you try in advance, do the exercise, and then try again. Yeah. And if it doesn't help, you try another one, yeah? But we can maybe try from behind. So what you will do, whose phone is it? Okay, just, okay. Okay, maybe you can do it like this. So you go here, and like an adductor stretch, yeah. Here?
Oh, yeah.
Okay. So, wait. So, we need to come in here. So, yeah. Okay. And you put it on the front. Yeah. So, and go down on your knee. And you go like to the front. Yeah. And the band is from this side. Yeah. And now again, she can, for example, tell me to pull more, or she can also move to the front to create more pull. I can maybe go a bit, this is better?
Yeah, actually it's better out.
Yeah. And then either you can stay, or you can move a bit. Go and come back, go and come back, go and come back. Okay? Let's do maybe 2 more.
Can we try like backward?
Yeah.
I know.
No?
No.
No. So why no? Because if I go here, I pull the bone towards the body, towards the pelvis, towards the other bone.
Yeah.
So generally we want to create space. So if I'm more here, so here I would pull it straight back, and here I would pull it back and out, which is generally feels better. Okay?
Yeah.
Okay?
Yeah.
Try? I don't know. Okay.
Wow.
Okay? All good?
Yes.
Okay, there's one more variant where the band is like this. Yeah, to pull the bone to the front, so you could do it as well like this, or you have the band attached to a rack if you are in a gym, but then you need an attachment point higher. Okay, or you need somebody that pulls like this. Yeah.
You do it yourself?
Huh? You could do it yourself, but I think it's not as effective. Yeah. Because you want to concentrate on what is happening here, and if you have to hold the band and it's a tight band, it's not so comfortable. Okay?
Yes.
All good?
Yeah, very good.
Good. So, then we're going to talk about motor. Huh?
But this you can use also if you don't have pain and just want to strengthen in maybe different muscles or muscles you want.
I mean, it's not a strengthening exercise, but for prevention, or if you just, let's say you trained, you went to a dancing class, and then in the morning there was another dancing class, and then Mark said, can you come in the afternoon as well? Yeah, of course, I come, of course. And then you come again, and the day after, you feel a bit your muscles or everything is a bit tight. You can also do it. It's not only if you have pain, of course, yeah? And it's actually a better idea to do some of this, because when I jump a lot, I compress my body a lot, creating space, relaxing, because it's actually an exercise that often feels relaxing. It's a very good thing, and is passive, like you can lie there, feel a bit what is happening in your joint, but it doesn't take so much effort, and is usually more effective than doing a lot of stretches like this, yeah? Okay? Because you're creating space in your joint, which is what you want if we are talking about mobility, yeah? Okay?
To be effective, how long you do the exercise?
So how long would you do it? Generally at least 30 seconds. Yeah? So if you found an exercise that is very effective for you, maybe you can stay there 2 minutes, 3 minutes, yeah. Maybe do some breathing, relaxing, imagining creating space in the joint, maybe going in the direction where you feel that you are more limited with the band, yeah. Okay. So, yeah. Mm-hmm. So, maybe I didn't explain this very well. Where are the hips, the hip joints? Here or here? Here. Okay. I see this a lot with my patients. People come and they say, I have a problem with my hip. If you show me here, you're basically showing muscles. You are not showing the joint. Okay. I don't know if this answered a bit, or maybe you can ask your question one more time, so maybe I can find to.
If I have pain
Yeah, yeah.
my joint.
This is something you could try as an exercise to help. Yes.
Okay.
This would be actually what I would.
You don't know if there's a fracture or if you don't know if
Okay.
there's something.
Yeah. So like I said before, if you have a pain that is very strong, or you feel like you cannot move like normal, you should always see a doctor. Okay? If you fell, I ran and I fall on my hip, or I felt something that is really bad, don't just try something like this. Go see a doctor, yeah, and be sure there's nothing on. But if it's just normal tension, or I did a lot of training and I feel it a bit, but I can walk normally, yeah. If you can walk normally, usually it's nothing bad, yeah. Right? It's hard to say because pain is very personal. Yeah, for some people, they cut their finger and they call, I can't work. Other people, especially when you work with dancers, so in my experience, they tolerate a lot of pain because they did a lot of stretches. For example, classical dancers, they are used to having pain, or breakers as well. They are used to their pain, and you tell them, how is your pain? It's fine, but they are sweating, so, or changing color, so then maybe it's not so fine. So it's very personal, yeah. So in this case, if you have, for example, a specific problem, I would say like you have to talk to a professional to be sure and to get some better advice. Yeah. Okay. Let's move on. If there's something else, you can just. So motor control, or what you can also call active mobility, yeah, is basically being able to control a joint, yeah, and to move a joint well in all directions. So what we did, this is not mobility, this is motor control. Can I control my joint and go there? Because I can be very flexible if somebody takes my leg and goes there, but if I tell you to do it, you cannot actually go there because you don't have the control. Okay? So that would be motor control. So I will show you some motor control drills, so learning how to move the joint, yeah, and because this is, first of all, is what you use when you dance and you move in general. You are not lying there and somebody pulls, yeah, or pulls your leg. You are actively doing the motion. You want to step somewhere or, yeah, okay? And this is both foot in the air, huh? So being able to control my hip when the leg is in the air, but also if I go and my foot is on the ground, yeah? So it's two different things. Maybe I'm very good at doing this, yeah? But if I tell you to turn here, you're like, how does that work? Yeah, you turn your body and you're not able to do it. Yeah, or for example, I will show something else. Going like this, yeah? And I tell you, for example, to do a circle with this bone. Maybe there's some moments where you don't really know what is happening, yeah? Okay? It's both. Because we humans, when we walk, sometimes the leg is in the air and sometimes it's on the ground. And for dancers, yeah, it's as simple as that. So ideally, when you practice or if you want to be sure that you are moving well in all directions, you train both. That's why I put this in there. Okay? Okay, let's go to the pelvis one more time. So because it's important, like Nora pointed out, if I go here, I'm not moving my hip so much. I'm just taking everything that is hip and pelvis, and I'm going there. So what I want is to know what is the pelvis and what is my hip and leg, okay? So this position, I call it, or you find it a lot as anterior tilt. So the pelvis is to the front. So the classical dancers are very prone to this. Yeah, they get taught this position, but they are not actually doing it here. They do it there. Yeah? Okay? And why is this important to know? A lot of people have this, even not dancers are prone to this over time. Like men, when they have a big belly, they will walk like this, yeah? And no, it's just Alisa is going home. Okay, so when your pelvis is to the front, you have less internal, external rotation and flexion. So for a lot of people, they complain about the problem here, but it's actually because they are already here and they cannot get further. If I go there, I can go higher. It's just mechanics. But if you are not aware of it, if you don't know about this, yeah, it can cause problems. And the fix is very easy because you just need to learn how to move your pelvis. Okay?
But it's also a disbalance of muscles.
Um,
How you get into that?
Yes and no. Of course, that's the consequence. But for a lot of times, it starts with feeling where your pelvis is. Like if I cannot feel this position, even if I give you exercises to strengthen muscles that would get you there, you are done with your workout and you're going to go back to your normal position. Yeah, strengthening is good, but you also need to feel first to know what your body is doing. Yeah?
Why so many people are in this?
Because most people don't spend any time on moving their pelvis consciously. They don't think about this. Or when you do warm-ups, for example, you will see this. I see this with dancers, but they are actually moving here. They do something like this. Yeah? And this is not the pelvis. This is the lower back. It looks more or less the same, but this is different. It's a small movement, okay? So maybe we just try this. You are not on camera, so you can try. And I already did it, so I looked stupid already. Okay?
I wanted to be on camera.
So just to tell you, so bend your knees. Let me see. Okay? So the exercises that we will try is just bend your knees, front and back. Front and back. Okay? In the beginning, it's good to put your hands here, or you put them on the lower part of your belly and on the here in the middle. Okay? And you just go back and front, okay? And just this movement is not so easy. If it's too hard, if you feel like I'm not sure what I'm doing, usually it's good to start seated, sitting or lying. Lying on your back and doing the same thing. Like this, and you go front, back, yeah? For those that work with students, this is, for example, something that you can include. You will have some laughing already in the beginning of the class, but it's also an area of the body that we usually, this is one reason why we avoid to train it or in a class. But if the people that are telling me what to do or how I warm up are always avoiding it, I never see it, okay? That's maybe interesting, a reason why it's interesting to think about it. Yeah. And it's not a hard thing, okay? And again, I forgot to say it, to test before, but you know where you were before, so maybe just test again your movement. Did something change for me? Because that's what it is about. Yeah. No, I don't know. Okay. I will show another one. Improvement? Yeah. Question.
When we are in squat, if we pay attention to that, do we have more stability?
Yeah, very correct. But it's not only in dancing. It's for everybody.
Yeah.
If you're, no, of course, but it's very right. So what he's saying is very right. Why is this very interesting? Because here I don't have so much strength also, not so much stability. Yeah. If you are more upright, you have a lot more stability. You get better activation on the front and on the back. It's more balanced. Our bodies want balance, and then they can perform. Okay? We can also try another one, which is a bit less known, is sides. So basically think about closing this space, so making the sides smaller. Yeah? But not like this, yeah? But really using these muscles, okay? And then if you're better, you can do the circle, okay? And it's useful, for example, to use a mirror in the beginning to understand, but then after also doing it without a mirror, because you want to feel. If you always do it with a mirror, you never feel it actually, and it's not so effective, okay?
For me, it's difficult to know when the back is starting to move with it as well or not.
That's very common.
This is,
Yeah.
I don't know what's the point in which I'm starting.
So, for example, what you can do is you can put a hand instead of, if you have no problem with the pelvis movement, you can put a hand a bit higher and try to feel when this is starting to move a lot. Yeah, on the back. Yeah. Yeah. So it can move a bit. It has to move a bit, the back. Yeah. If I go there, I don't want to see my hand going in and out a lot. Yeah. So this can help you maybe with this issue. Then there is some other ways to train this. Of course, some stuff I I didn't want to show here because it's too complex, but nowadays, for example, you can also attach a laser to your pelvis, and it tells you basically what your pelvis is doing. This is more like, you know what? You know what? I have a solution for this. You can put the laser here on the side. Okay? Okay? Yeah, pelvis is the most funniest subject. Okay? It's gonna get funnier. Okay? All good for the pelvis?
Yeah.
Did anybody feel an improvement in his test movement? Or no?
In my back, lower back.
Yeah. Pain?
No, gone.
Pain gone. Okay, good. Yeah. And for the others, it probably stayed more or less the same. Yeah, or better or worse. Did anybody got worse? Because,
With that move.
yeah, the side, it got worse. Okay, so what does that mean, worse? Worse in therapy or in movement always means interesting. Okay, because if something like this makes you worse and you are dancing and you have to go there, problem. Because in a training, when you try a choreo or something, how many times are you going to go there in one session? And then you go home, and for the next 2 days, I'm old. Yeah, and maybe the reason is just that there is more of a problem with control. But what I can tell you is, then this is not an exercise for you right now. Maybe it is in a combination with other things that make you better. So in therapy, how I would do it, for example, I would say, okay, we would maybe, let's say, we pull on your hip, and then you can go there and it's not painful, and then after 4 or 5 times it starts to be painful. Then I would do hip 2 or 3 times with no pain, hip, yeah, to learn, so that your body can learn that this is not dangerous, it's fine, it's good, yeah. Blah, blah, blah. Okay, next. Good?
Yes.
So, let's go to the hip circuits, okay? So this is actually, we are gonna do circles with the leg from the hip joint. So what the first step is, the pelvis has to stay stable during the movement. Yeah, because if I move here around, we are not learning to move our leg independently from the pelvis. Okay? So, to understand which one is for you, we're gonna use a test again, yeah? And you're gonna test which way goes better, inside or outside. Which one feels better from you? Of course, it's not the foot only doing it, it's the leg, yeah? It's from the top, yeah? So if you're not sure you're controlling it, put your hand on your thigh and go in and out. Okay? Does everybody found his position?
Yeah.
That is worse. Yeah? Okay? So, for the people that are worse when the foot is going inside, we will, this is the position you will keep your leg for the exercise, for the circle. So let's say I would just do a general circle. I would do this, keeping my leg turned in. Yeah. So sometimes you need to control if my leg is actually doing it. Because oftentimes what happens is, foot is in, we go here, foot is out. Then we are back in the middle, then we put it back in. But it has to stay there. Okay? If you're moving too much, grab a wall. Or grab a stable partner. Yeah? Okay? Remember, pelvis is stable. Yeah? Okay? And then test your movement again from before. For example, yeah, you could test this if you feel like you can get better, or if you got better. But you can also test your movement from before. Does any of this did any of this change? Yeah. Did anybody was anybody worse with this? No. Okay. So if that was the case, or if you didn't get an improvement, who did the exercise and didn't get any better? Also nicht besser gehen von der Übung. No? Okay.
Just out is worse now.
Yeah. So Alicia is that no. What we will do is we will try the same exercise out. So the leg stays turned out. Okay? And ideally you hold on because you want to focus on this moving and the pelvis not moving so much. Okay? Okay. Stop. Test again. So for example, for me, this one is not so good for me. Yeah? For you.
I feel like now when I go out it's better, but I kind of feel more tense when I go in now.
Yeah. So maybe another test would be telling us more about you. Mm-hmm. So if you would, for example, test your flexion, or you would test your squat and say, okay, how is this? We already, or for example, bending forward. Yeah, for example, for me, this is my forward bend. I do hip circles like this, with turned in, because I know it's good for me, and my mobility is better. Okay? So it doesn't just apply to your hip, it applies to everything. Okay? Okay. You can use whatever test matters to you. Huh? You can use a test that matters to you. So if you say my forward bend is something that I care a lot about, then you can use this as your test when you want to choose which exercise is the best for you. So we will do this again. For example, I show you two other tests. So maybe this forward bend, or how far can I turn? Pretty stiff for me. Okay? And then you can maybe look to where can I shoot. It's called the Tom Prater test or James Bond. No, I'm joking. And it's better to not stand. Yeah. It's good. Yeah, so if you found a side that is not so good, that gives you maybe that's very fine for you. Maybe for you it's your neck or it's your shoulder. Yeah, testing your shoulders. Do you feel a tension in the shoulders? Okay, and then we do the same. So now you choose the exercise that was good for you. I think for most people it was this. Okay, so now we have this is why I called it 4 positions. Yeah, because we can do it on the front, we can do it on the side, and we can do it on the back. Okay, so maybe let's start with this one because it's the hardest. Yeah, and you do small circles there with your foot still turned in. Yeah, if you're moving too much, hold on to the wall. It's about the hip, it's not about balance. Okay, relax. And do your test again. So either this, either your shoulders, either your forward bend, whatever you want to choose. Yeah? This is, if you move everything, then on the retest you have to move everything as well. If you are just moving this, then on the retest you just have to move this. It has to be objective. the test, you have to see a difference. You have to be able to see a difference. If it doesn't make a difference, what does that mean? It's not the most interesting exercise for you. That's all it means. And that you are maybe pretty good at this already, okay? So we choose another position, yeah? We go here to the side, and we do... It's worse. No. Okay, so let's do this.
Yeah, but I did it in, it was worse, so I thought maybe it would be out, and it was even worse.
Okay, so maybe do it on the front to do the opposite, and all the rest we do it on the side. And speed matters. So doing this, yeah, is very different than doing it in a controlled way. Yeah, because remember, we are working on control. So that's why even that we are good movers here in the room, holding on to something is worth it because I want to work on control. I'm not in a balance exercise. Okay? And when you're done, you test. So for me, it's better. Yeah? So that's why spending the time on testing this, some people on the back were like, oh, this is not so interesting, yeah? But when they do it on the side, maybe they have a change. Then we could do, the next position would be on the front. So let's take the time to go through it. Turned in, yeah, the leg has to be turned in, yeah? Okay, and relax. And test again. We are testing the 4 motions to find out which one is more interesting for you. Oh, yeah. Yeah. You know why. Because if you already feel that this here is not so feeling so well, and then adding to this is maybe not the best idea. Change? Yes, no, maybe.
Yeah, yes.
Better?
In front.
In front is better, okay, which is a bit maybe logical for you. If here was not so good, maybe spending more time. And then maybe thinking about muscles, yeah, from the beginning. Bringing leg to the front. So maybe for you, spending more time on strengthening the front is better than on the back side. So if you go on the internet and you type hip pain and they give you hip extension exercises a ton, maybe it's making you worse. That's why it's worth the time to test all of this. We have one more. Yeah, okay.
What are all the tests?
It doesn't matter. It doesn't matter. You can use this. Why I like to use this is because I see. But you can use your neck. Where can I see? Okay, don't. Yeah, okay. Yeah. Like this. Yeah. Okay, why? Okay, so why? Because when you spend a lot of time going in these ranges, your body is completely safe there. It's not a problem, okay? Okay, let's do one more. Okay, did I answer the question?
So is it a matter of direction?
You can test, so what we are using as a test right now is mobility. Yes?
Okay.
We are going in a range and finding out how does it feel or how far can I go. We can also use strength. We can use balance. We can use other things. I'm not going to go. For example, you could use like how well you see a target or stuff like this, but now we are getting weird. So, okay, but yeah, you know, right? Okay, okay. So, is that clear? So, maybe talking in this context or for dancers in general, mobility is a very good test, but strength is a very good test as well. So for example, doing a squat and how do I feel, and then doing the exercise and doing, oh, now I feel better, it's lighter, I can do it more quickly. That's also a good sign, a good test. So we had one more. I put it last because you have to be a bit more careful. So if you already have pain, maybe you can or you cannot do this one. Yeah. So it's to the inside. Yeah, because we had abduction, adduction. Okay. Okay. Relax. And test again. And also, most of you used the same leg all the time. Yeah? Trying on the other leg as well is sometimes worth it, especially if you know that you have differences side to side. Yeah? Any change? No?
Yeah.
You?
Yeah, I feel like if I do it with the right leg, I have more mobility on that side.
Yeah.
So now I'm trying the left.
Okay. Maybe we can put in a publicity. Like if
Yeah, it's really that. Train this leg, I can go further this way.
yeah.
If I train this leg, I can go further this way.
Yeah. But in general, after doing both sides, you feel a bit more flexible than in the beginning. Okay. Then it's good to maybe spend some time with this. Okay? Yeah. So, this is an interesting subject. Okay? So, this is really about feeling. Okay? So, we have something that is called the pelvic floor. Yeah? Women generally are more familiar with it. Yeah? We are not going into details. Yeah? It's just, for example, if you have to go to the bathroom, you have to hold it. This is pelvic floor. Okay? So, how to contract it is not so easy. So maybe we just sit down and you try it seated so you can focus on this. Stop before, let's do a test. And then we do, so we can retest after. Okay? So you do your test, just your normal test that you did. The neck, the this, or just your hip from before. Yeah? Okay? Okay, and then you can take a seat. It's not the most common subject, but it's a very important subject in sports. Yeah, because if I spend a lot of time jumping, moving, a lot of times people have too much tension in the pelvis or around the hips, which can come a lot of times from the pelvic floor. Yeah, so the muscles on the bottom of the pelvis. Okay, I wanted to bring a pelvis actually to show it, but okay. Yeah. Okay, so what we're gonna do is we're gonna do a contracting. But if you don't know what we are talking about, what you're going to do is just a long exhale, because doing a long exhale, you will, by reflex, you will contract it. So if you do, maybe you feel a contraction in the pelvis. So you can imagine like front and back. So this is why I put this. This is the front, this is the back. So you can even put your hands maybe like this on the lower abdomen. Yeah, and you imagine that you're pulling these 2 points together. Yeah. If you're contracting your glutes immediately, then you're doing it wrong. Okay? Or your abs. If you do, this is not right. Okay? So we will do. And imagine maybe pulling in. Yeah. And then hold 5 seconds and relax. Okay? Then just take a normal breath and we do it again. Okay? Again, long and holding, and really try to feel. If you need to close your eyes, you close your eyes. If somebody cannot feel at all what we are talking about, it's fine. If you want, you can ask me later. Yeah, we don't have to go into details about this. Yeah, I just want to show you this. So we do one more time and then we retest, okay? So again, inhale and okay, relax, yeah. For some people, if you don't find it easy, lying down works better for a lot of people, yeah, also. So then you could try it lying down as well. But right now, if you want, test again what we tested before. So now we did contracting, okay? Yeah, if you need to go to the bathroom, it doesn't really work. Yeah, you cannot really do it because it's like... Oh. No. We did contraction now, okay? We focus on contraction, okay? Did anybody have a change? Also test your hips, maybe. Yeah? So for a lot of people, this is very interesting, okay? Because if I do a lot of jumping and all of this, or even sometimes if I do dances where I have to go a bit on the floor and I fall on my pelvis or something like this, there's a lot of tension there, and usually you don't stretch this or you don't pay attention to it unless you have a real problem, which is for most people later in their life, okay? But there's, for example, a study with professional or going to be professional volleyball players, women, 17 years old, and I think it was like 30%, 40% already have problems with this from all the jumping, because they spend a lot of time jumping, okay? So a lot of tension. So for a lot of athletes, usually it's the tension, the problem. So now we're gonna go back and we do the active relaxation. Sit down again, or if you want to try the lying part, you can also lie down, okay? Huh? Yeah. Yeah, okay, same idea. We do the exhale. You imagine the two bones coming together, yeah? And then we do 5 seconds holding, and then we try to relax. So one second. Let's say your tension is here, huh? Your tension is here, normal, without thinking about it, okay? When we do our tension goes up, okay? And we start with this, because if I tell you from here, now relax, you don't know what to do. You're like, okay, I can barely know what you talk about, how should I relax? So what we're gonna use is we create more tension, and then we relax. We bring the tension level down, okay? So how you do it? Tension, and then relax and hold for 10 seconds. Okay? Go. Contract, and then relax and try to hold the relaxation. The next session we do together, I count, okay? So if you're ready, or let's try to start together, okay? Everybody ready? So exhale and hold for 5 seconds. 2, 3, 4, 5. And now we do the relaxation part, and we keep the relaxation for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Okay. Take 2, 3 normal breaths, and we do one more time together. Okay? Wait, a question? Yeah.
When you relax, you keep breathing? Or?
You can breathe, but if you from the reflex. Yeah. If you breathe in, it relaxes usually more. Okay, but we're spending 10 seconds, so you can just do a breathing and focus on the relaxation part. The breathing is not so important there. Okay, so let's start with contraction. So exhale and contract. 5, 4, 3, 2, 1, and relax. 1, 2, 4, 5, 6, 7, 8, 10. Okay, relax. Gently get up. What happens, what is very interesting about this is usually people relax a lot. Yeah, it's very relaxing. Okay, you feel like, oh. Okay, and test. Test. What worked better, contraction or relaxation? Yeah, you don't have to say, but know for yourself. Know for yourself. And now I want you to think about this more in an active way, because, okay, it's very nice to relax. Maybe I feel better after this when I'm lying, and yeah, okay. But you want to be able to control these muscles well, because if you're standing, waiting for the bus, or in your dancing class, and it's a break, and you're standing there with a lot of tension in your pelvic floor, you are losing energy and you are creating too much tension here. Yeah? So you want to, eventually you want to be so good that you can relax even while walking or by doing normal activities, okay? If I do a squat, of course, I'm not going to try to relax, yeah? I'm going to have a bit of tension and it's normal. But when I come up from the squat, I want to relax again, yeah? It's like in dancing, if I am very contracted, I cannot move well and fluid and soft and in a way that it looks nice and it feels nice. Yeah? Okay? Mm-hmm. Just to make the connection to this. Okay? Any question right now for this? No. Okay? So this is a quote I used already last time, but I like it. Yeah, the human body is not an instrument to be used, but a realm of one's being to be experienced, explored, enriched, and thereby educated, from Thomas Hanna. And so my message, or how I would formulate, is experience, learn, educate. Your body wants to be discovered. Like if you spend, for example, why did I put this weird part about the pelvic floor in? Because a lot of you spend already a lot of time with the hips and maybe looked already at some videos and already went to some professionals that told you about mobility and what you can do. But the pelvic floor, usually not so much. So parts that I have no awareness about, this is where you can make a lot of progress. Yeah. Okay? That's it. So a big thank you to Alicia and Mark, yeah, and all of you. Yeah, it was a pleasure. Okay, if there's more questions now, we can do that, or comments, or something that could be better, or if you would like, for example, more exercises or more strengthening or something like this, or something that I missed maybe. Something that was not so clear, you can just tell me. It's always welcome.
When we sat on the phone, when we talked, when I went to the logoped, the voice educator, she made a link with the pelvic floor and the voice.
Yes.
She was saying if you tense your pelvic floor speak, especially when you have to project.
Yeah.
Because it's gonna support the voice.
Yeah.
But it has to do with like. I really
I-
don't understand.
I can give you a bit of I can give you a bit of a link. So I'm not going to make it too complicated, but you have in your body horizontal muscles. For example, the bottom of your mouth, yeah, your voice muscles, yeah, and your diaphragm and your pelvic floor, and they work together. Okay, so that's why something like this is very common. Yeah, that or in other professions like or singers, they know this. Yeah, or if you shout, for example, you create loud sounds. Yeah, you feel tensing up here. Yeah, because these muscles, the pelvic floor muscles, they are there to keep everything in place. Let's say. Yeah, very simply said. So there's a very strong link between all of these muscles. Yeah, and also if you know that you have, for example, tension here, or you have problems sometimes with the voice, doing some breathing work like strengthening your diaphragm and doing some pelvic floor exercises, strengthening that is actually very helpful. And yeah.
Yeah, it's a nice visual to think of all this horizontal.
Yeah, horizontal. Yeah. Another question? It's late. I want to go home. No, not me, but I suppose.
Popping. So when you're doing movements that are so like explosive.
Yeah, yeah.
Especially like when we're using the legs and
Yeah.
the glutes, how can that affect your hip joints?
You want the answer?
I wouldn't say it affects your joints so much, but you, of course, what you are basically doing is the same than a bodybuilder.
Yeah.
Contracting a lot your muscles, so there's going to be some fatigue, and if you're always doing it from the same muscles, and that's basically why we chose this subject maybe for today, is that your hips, you use them a lot as a dancer. Eddie. Yeah, Eddie. You use them a lot as a dancer, and so if you are doing a lot always the same muscles because you're creating movements or that are very similar, of course you're going to feel it at some point. And pelvic floor as well, if you're doing every time, your pelvic floor is also contracting. So either, for example, I think you said that contraction was better for you. Maybe you get tired at some point there, and then you are not able to produce your movements as well, because your pelvic floor is the one that is not keeping up with what you're doing. Yeah. Or in your case, what flexors, maybe training the flexors, but for the joint itself, generally moving in different ways is very good. Yeah, the joint doesn't suffer from this. But if you have a lot of tension, fatigue, that's a problem. Yeah, and that's why a mobility exercise in these cases can be very good to relax this. Something less active, something more regeneration, imagining creating space in the joint, because if I stand a lot there and I take contraction and then I do a lot of side-to-side movements, yeah, that's a lot of compression, yeah, and then doing something where the hip is opened up is actually good for the joint.
I'm sorry.
Yeah, you can.
Because I was looking at some mobility program for opening up the hips, and they were saying that a lot of people, they cannot do like these splits without having this tilt as well at the same time.
Yes, because there is bones, okay,
Yeah.
and you are born with a certain type of bone shape, Yeah, so there's different shapes of how the joint looks or how the angle looks. And what you're pointing to is that very common for a lot of people, this bone is not actually coming from the side, but is a bit turned to the front.
Yeah.
So then I want to go there, and this has to move there in order to be able to put the leg. If this would be the leg, yeah, then your pelvis has to move there to create this space. And this you cannot change. Like, you can spend a lot of time doing this type of band thing, but with certain types of hips, it's not possible to go in certain types of positions. Yeah, and in old school, or when people are younger or kids, in classical training, classical dancing, they force them there, but then usually something can maybe break or be injured, which maybe in that moment gives you the ability to go there, but on the long term, these people usually get a lot of problems with the hips because you're, yeah.
Not necessarily beneficial to do that. If
No.
you don't need it for your
No.
dance.
No, it's no. That's like maybe the idea, or one big takeaway from today is, if you try out the program, you can try. This is what I said here. Try as many programs as you want.
Yeah.
It's actually good. Try many things, but one thing I want you to take away is test the movements. Do a test for you, either strength, mobility, yeah, something like this, and then do this exercise and re-evaluate what is it doing to me, to my body. And if that makes you a lot better, go for it. Yeah, but that doesn't mean the whole program is for you. Test every exercise, and I'm telling you, it's so worth to take this time, because otherwise you're going to spend hours and hours doing exercises, spending time in the gym, maybe spending some money on other exercises, and you are never getting what you're paying for or what you're spending for. Yeah? This testing is worth, and it takes 2 minutes, and usually if I test, I do my movement, I test better, then you can go with this for at least a few practices, even months usually, and always have a good benefit from this. Yeah. 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 Yes, you can do it. Yeah. Yeah. As long as it feels good, like, always listen to your body. If it feels good, if the exercise feels nice, do it. Like, I would say 5 to 8 times a day. That's why what I tell my patients. If you can and you want to get better quickly at something, do it 5 to 8 times a day. This applies for every skill. If you are learning a new move in dancing, is it useful to spend 2.5 hours once a week on this move? Or is it better to train it every day, maybe in 2 or 3 sessions for 10 minutes, 20 minutes? Because what happens in our brain is, okay, I want to learn this. Then our brain marks these cells or these connections. Then I sleep, I wake up, it did some work, I stimulate again, I sleep, and the more you repeat this cycle of training it, so marking these brain cells that they connect to other ones, so making these connections, and then also going through the cycle of sleeping or resting, so not doing it, is important for the process to happen. It's not useful to hammer at something for a long time. If you give your body the time to rest in between and you put in a lot of sessions, you're going to get quickly so much better. If you tested it and it's really for you, and I'm saying this is because even professionals a lot of times will not take the time to test it. Yeah, unfortunately. I know it because I'm not saying that That's because I'm thinking that my way is better, but I know that since I started testing stuff, things are moving way quicker, because in my classical education they didn't tell us that. But then doing some additional trainings, they tested and I changed my way of working. And when I take the time to test, and first of all, you see, okay, this makes me better, which also helps again for your body to be like happy about it. Like, okay, this is motivating, this is helping me, this is actually creating a change. Yeah. And you can even like put a mark somewhere. Yeah, I can put my leg to this part. Yeah, okay. And then you do your thing, and then, yeah, it's better now. Yeah, like be as objective as you want. Yeah, in therapy we use, for example, I do a lot of this muscle testing, but we also use, for example, hand grip strength, or you can use a laser to see, okay, how far am I distance-wise, like the thing that you use in construction that measures the distance. Yeah. So then I have an objective tool, more or less objective. But actually for you, you don't need something like this. If you just see, okay, I can bend better, my hip goes better, that's all the proof you need for an exercise to be yours. And it doesn't have to be these exercises. It can be whatever program that you choose, but just don't go with the idea, okay, somebody promised me something, I paid a lot of money for it, so it has to work. That's all I'm saying, because this is very important. Everybody works a bit differently. And so.
What if you want to, let's say you want to do a side split?
Yeah.
But every time you go in the side split, it makes you worse. But how do you get there still?
For example, bend, split, bend, if that was something that gave you improvement, yeah, because you are layering it, yeah. I do something that makes my hip more open, that feels good. I try my exercise that makes me worse, but I want to accomplish. Then I do again the bend that makes me better, and I do again my split. So every time you're giving your body some help of understanding or creating some space in the joint to relax, so that you can actually go in this position. And also forcing against what your body tells you is generally not a good idea. It's not gonna work. Never. It can maybe sometimes work, but the risk reward, not so. It's not a good idea. Yeah.
No splits.
Yeah, no. Gave up.
No, I mean, yeah.
Yeah.
But still having
You have to understand. If I go back to the slide where there was about the hip changes, yeah, the way we move changes our body. Okay, so if I spend a lot of time jumping, and turning, and a lot of time dancing like this, let's say I come from hip hop or I come from house, and all of a sudden at 35 I decide I want to do a split. Your body already adapted to something that you are doing all the time for years. So maybe you have some hip changes that won't allow you to accomplish a split in 3 months. So maybe it needs 2-3 years of constantly working on this in order to fix this. But a quick, you see it a lot in strength training. People say, okay, you want to lift, I don't know, do a bench press for 100 kilos, okay? It all depends on where you're coming from. If you never did that, maybe you can accomplish it in 6 months, but not in a safe way. Why? Because the muscles maybe give you that possibility, but the joints, the bones, the ligaments are structures that take 1-2 years to be ready for this load. So it's not a good idea to do it. And these are laws of nature. Yeah. So basically, either you respect these laws or you take a risk. Yeah. And of course, when you are younger, let's say you are 20, you can do this, you get faster results because our bodies are doing this, but later on is perfectly possible to accomplish results, but you have to be more patient, you have to be consistent, and you have to be more patient with when you were 20, where you just can move and your body finds ways, because the connections are faster. So when you are younger, you maybe learn something and the next day you know it, where after 27, you can do the same thing, but you need more repetitions. You need to do it maybe for a week, every day for 3 times 5 minutes, and then you accomplish the same thing. Because you already know also a lot more. So it's like there's not so much space, you need to change some stuff, and yeah.
And that's why.
Yeah, it is, in a part, it is why. And it has to be new. If it's always the same thing, your brain doesn't pay attention.
Yeah.
Okay? We can go on about this.
Good.
Thank you so much.
Merci, Yann. Thank you so much.
Thank you for coming.
Super cool.
Yes.